Today we are privileged to have in our studios a family counselor consultant. She is Dr. Kodrat Bimbo Sanni. She is a senior lecturer in the Department of Educational Foundation, Guidance and Counseling, and Faculty of Education, University of New York. You're welcome to our studios.
Thank you.
Today our focus is on sex education, the role of parents. Now we're trying to look at how this can be averted. It has become massive. It's no longer a hidden thing. So what do you think led to where we are now?
I used to know that, which is formal and informal, that parents are responsible for their children's personality. And this no community hides. No community hides this. They do it with all dexterity, with their energy, with determination and passion they could put in. And so, one man's child is everybody's child. And all the children in society belong to everyone. So, training was, very particular about children in terms of their nurturance and their growth for better society. But these days it's like we are forgetting very fast what we used to know about parents and the upbringing of their children. Of course, today most of the homes are, they are nuclear in terms of structure. We no longer imbibe, or we no longer enjoy the extended family system, which of course the extended family system has its own advantages and its disadvantages. But today is like we are much embracive of the nuclear family, and what comes in or what goes out from the minutest family side goes outside without any other family members adding or giving any input, whether good or bad. And today we find ourselves in this situation that what used to be sacred, sex used to be sacred. It used to be a taboo. Nobody talks about it freely. But today, in the world of technology and globalization, people, children, adults are exposed to media, content, the ones they like, the ones they do not like, and the one that they are, initiated into by their, peers, whether old or young. And you find that you get some uncensored messages that may not be too good for the old, may not be too good for the young, but you find out that both the young and old are guilty of watching it. But who is to be blamed? The adults. Because the adult is a parent and is supposed to do some fundamental thing about child's nurturing, which we find very absent these days.
Talking about sex being separate back in the days.
Yes.
Now, a lot of persons have come up to say that it is no longer necessary to keep it separate, but to rather come up with it and discuss with their children so that you can get to know what they know already and maybe make corrections. Do you think sex education is ideal for children now?
Of course. But I beg to use the word sexuality education because there is a clear-cut difference between sex education and sexuality education. All right. When sex education is talking about gender categorization and sexual activity, sexuality education is a broad phenomenon. Even though sex and sexuality education could be used interchangeably, but there is a thin line between the two of them. One is segmental and one is broad-based. Because it's the one that is talking about relationship, sexuality, attitude in relationship, your sexuality, and even your hygiene, your personal hygiene. It talks about it. It takes into consideration your mental orientation. It looks into your social calling, and it also looks at your psychological disposition. And this talks about your mental health.
Okay. Now, coming from a cultural background that we are, like Africa, Nigeria, we believe a lot of priority is placed on the male child. And I think upbringing, like you said, matters a lot. So these men are brought up to believe that they can get whatever they want, they are supreme to other people, and they can do whatever they like. And it's kind of playing back at the society now.
Yes.
So what do you think should be should be done in terms of our cultural orientation? Because it's quite a job.
Yes, it is. You see, one thing is, as much as we cannot do away with our cultural background, because while I was trying to describe sexuality education, I talk about cultural, I talk about personal.
Okay.
Now, we have our pasts, and no individual can grow beyond his past.
Exactly.
You must know about your past so that you know how to forge your end. Knowing about our cultural, background, that we used to, we prefer kind of, the male child to the female. And in our orientation, more emphasis then used to be on a lady. A parent or a mother tells a child, sit well, you are a girl. Cook well, learn to cook well because you are going to cook for a man. Learn to soup well because you are going to stay in a man's house. Learn how to talk decently and dress decently. Even though the male children are nurtured too in terms of value, African value, but you see, they are more nurtured in terms of power, responsibility. They are going to, take care of the home. They are going to manage a woman and whatever comes from her, or both of them. So that is the direction. Valor, power, honor, respect. It's cultural to say the man is the head of the family, even the scriptures. And they are not wrong anyway. But we see that today we have imbibed, the European culture. And we seem to forget our own. That is the problem. There is nothing wrong with our culture. Because you see, when you talk about male, female, discrimination, you look at the stereotyping that Africans give to it. But as we get educated, we seem to forget our own culture and imbibe a culture that we do not really understand. And that is where the problem is coming from our cultural background to the home.
Glad to know you're still there. Yes, we're still talking about sexuality education, the role of parents. And now we have been able to identify that there was something wrong, and it started from the family cycle. We're still with Dr. Sanni, and she has more insight on the topic. Okay, talking about that, what is your suggestion?
Yes.
Okay.
What we are saying is, does that mother recognize the power of sexuality education? Is she aware of knowledge and skill in sexuality education? Is she not shy of talking to the child? Because many parents today believe that when you talk about sexuality education, you are talking about sex and what a child can use to stop pregnancy, the pills, the pranks. And so many parents have been attacking moves by governments, whether national or internationally. Some parents have been, on the neck of government that, look, we don't want you to teach our children immorality, because some parents feel it's immoral. And for some highly educated people, I go to fora where some educated people talk about sexuality education, and I get scared for this country. Because in developed countries where they sing it, they teach it in school, and they inculcate it in their children early in life, they still have this problem of rape and other. But maybe it's strange to us, the rate at which it's growing. But we shouldn't be surprised, because we are not talking. We are maintaining the golden silence. We are not talking. We are not bothered. We are rather shy. Some educated people will tell you, you mean, a man for instance, you mean I should tell my son that there is something in the morning called wet dream, and he should know how to handle it? No, I can't do that. The mother should be able to do that. You mean I should talk to my daughter about menstruation?
Exactly. It's quite, I want to bring an insight on my little 4-year-old daughter did. I was actually helping her to take a bath. And now she was mentioning parts of the body. She talked about the eye, the nose, and she said, this is Botox, and what do you call this other side? I was speechless. I didn't know how to answer such questions. Now, the thing is, mothers aren't aware of the best language to use to address certain issues with these children. What do you think can be done to address such situations?
There is need for awareness. And with what is trending, rape, and the different shapes it's taking now, means that we have to be alive to our responsibility. we come through stages in life, developmental stages.
Yeah.
Maybe let's talk about infancy, because these days when a 3-month-old baby is raped, what are you talking about? What are you looking at? And you cannot sensitize your children. The trend in the world is you must sensitize your children, and it cuts across age. You are not talking about, oh, educate only adolescents. Before it gets to the adolescence period, what do you expect? He must have been misinformed, confused, and he has conflicting idea that he may live through all his life, and he lives an abnormal personality. But what we are saying is that at that age of your daughter, 2 years, you need to mention, I'll use myself as a personal example.
Okay.
Not you may say, because, okay, I'm a teacher of sexuality education,
Yeah.
I teach it, I discuss it in different, seminars, conferences, that people should change, parents should change their orientation. At an age of indoctrination, you have to indoctrinate them. And when they get to the abstract age, say from 11, 10, you begin to talk abstractly the way they understand to them. But at very tender age, as once they start talking,
Yeah.
you say 1 year. Let me tell you about my she's 12 now, my 3-year-old daughter. The indoctrination, part of what I tell her, when she comes to my room, she has to knock, and when she knocks, she comes in. I tell her come in. Deliberately, I will tell her to come in. And when she came in, what happened? She saw me in one of these days putting on my sanitary towel. And she came close. I was still trying to dress properly and use a screen. She came close because of that bonding and said, "Mommy, you are using Pampers?" I said, "No, this is sanitary towel." He said, "Sanitary towel?" I said, "Like Pampers?" She said, "Like Pampers?" I said, "Yes." "Oh, this is blood." I said, "Yes, adults used to have blood, female adults, but children don't have." And I like to draw a lesson from that for her. And I sat at her and told her, if anybody touches this place, if anybody touches your chest, I mean here, and I physically demonstrated, or anybody wants to hug you so closely, aside from daddy and mommy, don't agree. She said, I said, because blood may come. Indoctrination. But I never failed to tell her, this is your buttocks. I refused to say bum bum. And I told her, this is your vagina. I started telling her before 3. It's very, very important, so that nobody will manipulate her. Let her know. And I tell her, nobody should touch your vagina. This is your vagina. This is your buttocks. And I tell her, this chest region, this is where your breast is. He said, "Mommy, my own is not as big." I said, "Very soon it will come."
It is.
When a man start touching here, anybody aside from mommy, daddy, don't allow them, because blood may come. And that was indoctrination. And you keep watching your child as he's growing, like I was doing with my last baby. So I kept telling her, when I saw that she could understand, I changed the method.
Yeah.
Now, you can't say there's a particular clear-cut method. It depends on you and your child.
Yeah.
But one important thing is you tell them, because if you do not tell them, people who are close to you, your relations, everybody is a suspect now.
Indeed.
Your relation, the domestic staff, artisans who come to work for you, your friends, your husband's friend, can be a culprit. Anybody can decide to abuse anybody in your house.
Okay.
So you have to inform your child from childhood. You don't leave anything to chance. Tell them. When they ask questions, don't just tell them to go off you because you're tired. Find time to explain to them, depending on their age, and let them know the truth, because the truth will save them.